What's up, everyone on YouTube? Question for the day is, John, when do you know when to do a holding phase? And so this might be a holding phase, or sometimes we call these a gain-taining phase, or I know some people hate the term maintenance phase because it seems like you're not making progress forward, but they are necessary at times, and there's a few reasons why these kind of end up happening regardless whether you're choosing to do them or not. But within an off-season period, when you are progressively increasing food, you're progressively increasing training volume, training stress in general, PEDs are escalating, there's going to be some stop point as why you just can't keep doing that over time. One being health markers are getting deranged from, primarily if you're enhanced, the derangement of blood labs. Maybe blood pressure is elevated, maybe blood glucose is getting elevated, there's more inflammation occurring, and you have to do something about this and address it. If you're not enhanced, or just in general, just high food intake along the way could cause more insulin resistance or blood glucose getting more elevated. This might cause a greater partitioning into body fat over muscle tissue. So we have body fat accruing, and with consideration that at some point, if you're a competitive bodybuilder or whatever division you're in, you're gonna need to diet back down. And so being like, 25% body fat and having like a 40-week prep is likely less than ideal for a number of reasons. Another aspect is with training just being accruing over months and months, you could end up with a lot of fatigue present, an unsustainable amount of training volume, but also you could be cropping up connective tissue issues, joint kind of wear and tear that's occurring, that you might need a period of a longer duration than this 1 week of a deload to reset all of this. And so this is kind of like the aspects of when this might happen, but there's times when it kind of happens anyway, right? You get injured, then you're forced to do take the time off, or health markers are so deranged, like, oh gosh, I have to do something about this, or you just live your life in ignorance of the fact. Or this gets into really less than ideal off-season scenarios, and you don't have that setup period before you go into your prep, and it just takes a long time to get moving for you really see the fat loss occur, and then it finally gets going after those few weeks. So this is when this holding phase can really have its play, and not letting your off-season go so far when you become real suboptimal and health markers are getting poor, nutrition's getting partitioned more to body fat and so on. So when this should be happening is at that time point. It's going to be different for everyone, and also it could be a point where you just ran out of time in the off season and you have a shorter off season time period, and you should have this setup phase before going into your next, whether it's fat loss or contest prep. And so what happens during this phase is nutrition, everything that's driving the stress response is brought back down. So whatever's your reason for going into this holding gain-tain phase is basically the main thing you want to be pulling back on. So if the root cause driving health markers is PEDs, well, we're pulling back on PEDs. And remember, it's very easy to maintain tissue relatively, so you can have lower PEDs in this phase. We can bring back nutrition in this phase back to closer to a maintenance level, which a 10% reduction is a pretty good starting point for a lot of people. You also want this phase to be setting up yourself into your contest prep. So getting yourself used to those fat loss pathways, getting cardio in place so it's easier to move it straight into prep. If you got to a point in your off season where you're only doing, say, just step counts and not a lot of direct cardio, you might have some of that put in place, and maybe you don't bring food down as much in that scenario. This also would be a time when training is pulled back. Maybe you have that extra rest day in place, or you just have a little bit of reduction in volume. That way you can really recover and be fresh for going into a contest prep period. So this phase, I've seen some people call it a primer phase, because you're almost setting yourself up, priming yourself into the next phase. So that's why you would want to use this. There's also rationale of potentially maybe there's a cementing of gains that can happen. You hear like get to a new body weight and hold it so it sticks. That might be just a lot of theory behind this aspect. We've seen some early research in delayed muscle growth, but it's probably more so a removal of fatigue, and they're seeing in these studies is a process that has been occurring along the way the whole time. It was kind of blurred through what was occurring through really, really hard training. But there's this potential there of, like, holding this body weight, getting it more stabilized. But I think it's getting the body stable so you're not moving from a high point of really high fatigue into another point of a contest prep, now with low food, more cardio, which also is more fatigue. So high fatigue already in a push phase, right into a fat loss phase. You're not doing anything for that fatigue, so you might have a quick period where you're moving into this fat loss phase, and you might set yourself up for more tissue loss than what you had rather than doing it like with this kind of gain-tain type of phase. So if you have a question further on this, leave it below, and I'll answer it in one of these Q&A videos for you guys, and hope to talk to you next time.